agenda item. As the board will recall, we took the basis of a 26-27 annual plan to the board in March. We acknowledged that as we were carrying a financial deficit, we could not approve the plan. We sent it into Welsh Government for scrutiny. We had that scrutiny back and we looked at it again at the end of May. We've had further requests for additional information and submissions from Welsh Government. So today we are taking that additional information that we will put in a resubmission. So that's what we're being asked to approve today, rather than the plan itself, which can't be subject to approval, as we know. So I'm going to ask both Claire and Abby to take us through this. Who's starting off, please?
John, perhaps
Abby, are you?
Yeah. Thank you. Perhaps if I can just position where we are in terms of strengthening the plan, in particular the financial position, recognising this is an annual plan because we are not in a position to have an approvable fully integrated medium-term plan, but the importance of setting this in a 3-year context that would see us getting back to financial recovery over the course of that period. So perhaps if I can just say a couple of words in terms of the key areas that we've strengthened it, and we have attached for the full public version of the papers, the updated plan, which is the plan we are working to in the organisation. So a couple of points to pull out, if I may, Chair. Clearly, this is a plan that is now setting out much clearer line of sight and programme of work over the next 3 years to get us to financial balance. That comes under a number of different streams of work around, which Claire can expand on, around ensuring that we are disciplined in terms of utilisation of our existing resource to best effect. We can evidence that we are making best value and we're being productive and optimising use of our resources, that we are identifying where we need to reconfigure or deliver services in a transformed way to enable us to make best use of the income that we receive both from the Welsh Government allocation for our population and the income we receive as a provider of services to other health boards, either through the Joint Commissioning Committee or through direct commissioning with neighbouring health boards. You will see in the plan that there is a pipeline of just over 180 million of opportunities, and in the 26-27 element of the plan, you will see that we have much greater confidence and granularity around the plan that will enable us to deliver the first year of that 3-year journey to progressing to a sustainable financial position. Some of those may not come to fruition, so the important message for our organisation and the teams are working on is that we continue to have a pipeline of opportunities that we can test quickly, and if they need to come off the table because they're not something we can deliver, or they will require perhaps a longer term beyond the 3-year, that we have those in the pipeline. So what we now have is a very clear process for grey schemes, which are things not yet worked up in detail, working those through into red, where we've got much more confidence that they are deliverable plans, and then as we go through the criteria for amber and green, getting the granularity and being really explicit where the cost, the hard green pounds are actually taken out in terms of savings. So we have really strengthened that progress, and the delivery unit has really supported us in doing that. It continues to be strengthened and embedded as a way of working. The plan also articulates very explicitly what the drivers are. You'll recall the work that our partners Deloitte did with us to understand better what's driving the costs at the moment. And of course, that informs the plan in terms of where we can reduce the cost and avoid expenditure and make best use of the funding that we have available to us. We've touched upon before, and Claire might want to expand on this, tightening of governance and accountability. And really that goes hand in glove with the Organised for Success programme that Tina has been leading, which looks at both organisational structure but our operating framework. And as part of that, the performance and accountability being a really key aspect of that. The plan also represents strengthened articulation of delivery. I think one of the feedback that both board members have given us and Welsh Government, as in some instances what we were really describing was a plan for a plan. What I hope you will see is that our delivery actions are much more explicit, and they are things that we are getting on with now in relation to the key priorities for the Health Board, in line with Welsh Government expectations next year. Chair, I think it's important to that is in relation to planned care, emergency and urgent care in particular, and we know where we do have some capacity challenges that we are going to need to address so that we can maintain the position on the 104 weeks. We know the new government wants to go further. They've obviously recently announced a substantial investment that will come through. I've had very positive, and so have Craig and Kerry Gimlett in the team, in the Chief Operating Officer's team, around how we develop our plans. We've had assurance around our assessment of the capability and capacity gap in terms of our services, and working very closely with Welsh Government about what that programme of work will look like as we get clarity about how the additional funding will be accessed and utilised. But those have been really positive conversations. We've given a commitment, as you will see in the plan, to hitting the Welsh Government requirement for a maximum handover of ambulances that arrive at our emergency department within 45 minutes. The target should be 15 minutes, and we're working very hard to achieve that. And again, there are a series of actions that are detailed in the plan that enable us to demonstrate progress against that. So we would be looking to achieve 80% delivery between 7 AM and 7 PM, recognising that we've got more challenges around senior decision making overnight, and then by September moving to a position where we'd achieve that target for 95% of the time. There's daily reporting now that enables us to track our progress, and we're giving that really strong due attention. The programmes that I talked about when we discussed the annual report in relation to perinatal and mental health remain a really strong areas of improvement for us in this plan. So people will be able to read the continued improvement that we expect to achieve over the course of the year. And then the final thing I wanted to say was just in relation to our escalation status. Colleagues will be aware that we're in level 4 escalation due to the position with our plan in particular, but also some of our areas of delivery. We will be bringing back to the board in July oversight of our improvement work in relation to cancer. That has been a disappointing area of performance during the course of last year and into this year. We've done a lot of work to look at what the where the hotspots are, what the barriers are, what the blockages are in our patient pathways. And we have some important activity taking place that will improve our position, but we do have some underlying sustainability issues in terms of core capacity. And again, we'll be considering some of that in the July board meeting in more detail. And in relation to your point right at the beginning, Chair, this plan doesn't meet the criteria of an approvable plan in the terms of Welsh Government. We are not able to deliver all of the requirements in terms of the financial position and achieving financial balance within the financial year. And as I said, some of the areas of delivery, we are working very closely with NHS Performance and Improvement and Welsh Government to ensure we can deliver stretching but credible and realistic improvement plans and improvement trajectories. I'll pause there, Chair. Claire will take us through in more detail the financial position, and I'm happy to take any questions subsequently.
Thank you, Abby. That was really helpful, setting the context for this plan in the 3-year trajectory, because of course there is a recommendation for the board to approve that trajectory at the end of our discussion. So Claire, would you like to pick up at that point, please?
Yes, thank you, Chair. So as Abby has discussed, we have done detailed work as a finance team to demonstrate increased confidence in our ability to achieve financial control balance by 2028-29. And this is due to a greater understanding of our deficit, our inflationary pressures and risk assumptions, and we've cross-referenced those with working with the NHS P&I financial teams. And this was shared with the board at the board development session on the 15th of April and subsequently with Welsh Government. It highlights really the challenges we as a board have in absorbing cost pressures from National Insurance and Band 3, also the growth and challenges in absorbing the medicines management and the complex healthcare growth and price pressures. We have strengthened our opportunities pipeline of 181 million, recognising the need to balance of 177 million. And this pipeline continues to grow, I think, reflecting the integration of the savings plan alongside the performance framework into the service groups and incorporating the local opportunities that we unlock as a part of that process. As a minimum, we are aiming to achieve 76.6 deficit, underpinned with the savings plans of 65 million. And we are increasing the translation of ideas from red to amber and green, and are confident by the end of Q1 we will have nearly half the pipeline in that status. There's an increasing role of the delivery unit incorporating the finance business partners and the business intelligence team. So since the completion of our previous plan at the end of March, what we've done is in really four key areas. One is we've done the detailed benchmark and shared the information and assumptions with key stakeholders. We are really, as part of the Recovery and Sustainability Board, maturing the level of pipeline savings, but increasing the opportunities and the strength of that pipeline. That there is a focus on recurrent savings, which I know is an area of focus for the performance and finance team, which currently in the pipeline shows for this year a 78% proportion of recurrent schemes. And that has actually enabled us to forecast a £9 million benefit into 27-28 as a result of the savings and milestones that we are delivering currently. As I've alluded to, we are using the performance framework and the monthly service group reviews and escalated service group reviews to identify their initiatives alongside the Deloitte's themes to support, and those are supported by the delivery unit. The third thing is really we've strengthened our grip and control, and as you know, we've strengthened that through budget holder accountability, increasing our budget holder cohort to 67, providing them the relevant training both financially and from a procurement perspective, and also formally writing to them not with just their finance responsibilities but also their workforce and performance responsibilities, really focusing on our breakthrough objectives. We've improved our financial monitoring and reporting, and we are now looking to enhance our reporting so it gives greater granularity on the performance against our plans, and we've shared those with the Performance and Finance Committee for comment. Our pay and non-pay panels remain, and we are holding our reduction in headcount, and we are obviously focusing in variable pay. And notably, we are seeing continued reductions in the medical pay in that context. We've improved the financial reporting and we are escalating, which really supports our financial grip. And actually, I think that reflects our first 2 months positions, which, whilst a deficit, demonstrates some of the impact of these actions and an improving trend. And we are aiming to achieve the deficit run rate by the end of Q1. Finally, I would say all of those actions have been overseen not only by the Performance and Finance Group, but also the Performance and Finance Committee. And we shared this detail on the 22nd of June. And we've also shared our pipeline with the NHS P&L through the P&I meetings. In summary, we have undertaken further detailed work and through which I hope it's demonstrated increased confidence in achieving our balanced position within the 3-year time frame. The overall financial plan position is to deliver a minimum deficit of 76.6 with our £65 million savings, and to continue to work in strengthening our opportunity pipeline and that savings pipeline over the period, 3-year period. So I think that summarises for the board the actions that we've taken to date and the strengthening of that plan that we now wish to resubmit. Thank you, Chair.
That's a really helpful run through all the actions that have been put in place and that continue to be worked through following from the original submission. So Pat, shall I ask you then on behalf of PFC, because we know that PFC met on Tuesday, can you give us the views and the advice from PFC, please?
Yes, certainly. As you say, we discussed it in detail on Tuesday. I think the members recognised and took assurance from the amount of work that's been done, particularly over the last months that both Abby and Claire have just outlined. And we're seeing growing executive confidence in the delivery of 76.6 million deficit. Just to take you through some of those pointers then that did give us assurance. We are seeing a reduced deficit position in month 2, and the forecast for month 3 is a further improvement down to 6.35 million, which would be within the, required to meet the 76. We have seen improved recovery and sustainability programme governance led by the delivery unit with a stronger focus on outcomes of change. We've got a way more robust approach to saving plan delivery through PIDs, and the progression of those savings schemes through the Welsh Government tracker process is robust, with plans tested through check and challenge meetings with the SROs and the delivery teams arranged by the delivery unit, where those meetings review the actions, the milestones, the financial assumptions, the accountabilities, and there is an experienced cost accountant validating those figures as well. And once those saving plans are in Green and Amber monthly, finance can see those down at cost centre level, which and can be monitored on that basis. As Claire has outlined, there's been an improved approach to budgetary management and control. So I won't go through that because we've been through it before. The service groups, we took assurance that they're now being held to account to a greater extent for savings delivery. There is an escalation process in place where savings delivery is not on track, holding the service groups to account and challenging them to develop mitigating actions to address shortfalls. A lot of work has been undertaken by Claire in terms of the team of finance business partners to encourage a more open, transparent and less risk-averse approach. And as Claire has said, we saw at month 2 16.7 million in Green and Amber, with a target of 31 by the end of June and 65 by the end of Q2. And as Claire noted again, the recurrent savings pipeline is 74 million, which is 9 million above the 65, which will impact positively on next year. So there was a range of things where we did take assurance, but there are also areas where the committee members still do have concerns that were raised in the meeting in relation to savings plan delivery. This is an early point in the year, and at the moment we're seeing very limited evidence coming through of actual saving plan delivery in the ledger. The financial presentations that we saw from the service groups and the service group financial forecasts at the moment are not evidencing operational integration and alignment with those executive-led savings schemes. And there's still a lot of work to do for the SROs, for the delivery leads, through engagement with the service groups to ensure they're buying their ownership of the savings plans at that operational level. We do have key concerns about delivery capacity still at a number of levels. Executive leadership capacity, given the whole scale of savings and performance improvements, the capacity and capability in service groups to drive the necessary operational change to deliver the savings and performance improvements. And the delivery unit currently, while this is coming together and progressing, there is still a lack of programme and project management capacity and expertise in the team. which really it compounds the kind of, the leadership delivery capacity, really, if we don't have that. This was echoed in the meeting by their new head of the PMO, who reflected on a lack of experienced project management staff in the unit, and currently they've got no single unified methodology for change management. He did talk about the work that's been done in relation to this, and looking at internal solutions to the lack of project management capacity were being explored. So there's active work here, but we felt really this is something that rapidly needs an assessment. And although there may be a cost to getting additional project management expertise in, it might be false economy not to look at it if we are going to fail to deliver the saving plan by the timescales in place. So I think that needs some kind of rapid assessment really on that. Also finance capacity, but it was noted again that the appointment of the new deputy director to Claire is being progressed as we go through. So we really welcome the strengthened approach to performance and accountability. But members were waiting to see the outcomes of that improved approach to delivery discipline coming through in the results. And we noted ongoing system pressures remain. Sickness levels had increased to 7.26 in May, and we still have 192 clinically optimised patients, so that pushes pressures into the system. So we noted that as an absolute minimum, the 65 million savings have to be delivered in year. We need a bigger pipeline than that to act as a buffer for the part year's effects, and that would possibly impact on the next two or 3 years. And seeing that revised forecast being constantly updated for that is going to be good going forward. So at the end of June, we won't be able to submit evidence of the 65 million schemes being in green and amber, but by the end of Q2, the expectation is we will be at 100% by the end of Q2.
Thank you, Pat, and thanks to PFC as ever for the rigour of your scrutiny. I'm just going to ask Steve and Jean if they want to add anything to that, because Rena's not with us today. Steve, do you want to add? Steve?
Sorry, people keep muting me. Sorry. I just echoing what Pat said. I mean, those were the findings of the PFC, and Pat shared those her summary there with us over the last day or so. There's a couple of things I'd like to ask Claire, though. One, and I've asked her this first one before. One is, and Pat alluded to it. There's 65 million savings this year, which we must achieve. Delivery hasn't really got going yet, and are you therefore confident that we will be able to deliver the full 65, even those schemes which won't start maybe until the late summer, and so we need a full year's impact in 6 months, as it were? Are you confident that we'll make at least that 65 in the current year? And I know you've got a bit of a buffer there. You've got an extra 9 million. The second question is, we're now clearly focusing on 3 years, much more than 1 year. We've got to do this 1 year, but we're saying to the outside world, we expect to achieve our control total of 17 million in the 3rd year. So do we already have the 60 odd million of saving schemes, if not lined up, but certainly in the back of our minds for that year 2 and then that year 3? Because what we can't do is get to the beginning of next year, having achieved the 65 this year, but then be going through all this again because we haven't got the schemes ready to run in year 2 and then year 3.
Thank you, Steve. I'm going to bring Jean in, and then I'm going to come back to you, Claire. Jean.
Yeah, thanks, Chair. And thanks, Claire, as well. Pat has covered all of the discussions that we've had in performance and finance, so I won't reiterate the figures that she's mentioned or some of the issues that we are still concerned about, as she's given you a very clear understanding of that. What I will say is that aside from the discussion on the figures, we are also very clearly focused on the need for consistent performance management especially in terms of the massive cultural change that we're going through. But that's sitting alongside responsibility and accountability are essential components of our programme to achieve our desired outcomes. So yes, we have strengthened governance and accountability, and we are seeing some of the fruits of success. But an eye cannot be taken off the need to invoke strong and consistent performance management to affect the delivery of what we have in front of us.
Yeah, thank you, Jean. That's a really, really important point there, as indeed are all the points that Pat, Steve and you've made this morning. So Claire, can I come back to you on this question of when is delivery going to get underway? And this whole point about the connecting rods between executive-led schemes, service groups, and the seeming gap between those at the minute. And then Abby, perhaps I could come back to you on the wider capacity and capability issues, and then I'll open it out more widely. Claire.
Yes, thank you, Jan. So I am increasingly confident we are going to achieve our £65 million savings plan this year. And the reason I say that is, A, because I know Raj will deliver his medical pay and he's got actions and activities around medicines management that he's sharing with us at the Transformation Board. Equally, the work that Tina is doing on the A&C to ensure that she will deliver deliver a greater pipeline actually of activities, because I know the work that she's doing, not just for this year, but for next year. Equally, Liz's nursing transformational programme that she's already started, and I think she's up to 7 wards now in terms of that transformational programme and the benefits where they were given. And equally, Chris, even though I know she's like looking into the twilight of retirement, the work that she has done with the other workforce groups to develop a PID that will anticipate save more than £1 million this year and have recurrent parents benefits going into other years. And equally, the work that Matt is doing to enable all of this through the digital, and the work that his team is now doing in developing those savings plans and bringing them forward to the team, and also the work that Craig and others are doing on the planned care and UEC work, which again is exciting stuff. And equally the work that we're doing in and around improving mental health and the mental health transformation. So that pipeline for me is the start of something that is going to underpin the transformational programme. And with the support of my colleagues around the table, I am confident that we will, as a team, deliver on our savings commitments for this year. But that's this year. And quite rightly, we should be looking at this strategically and looking at a sustainable financial position for Swansea Bay. And that therefore becomes my challenge in Q2, is to work with the teams and pull those strategic threads that they're working on into that financial plan through that pipeline and present you back that. So we're in advance of next year. And the heartwarming thing for me is that we're doing our homework for next year because of the high level of recurrent savings that we are now actively targeting, not just as an exec level, but through the performance and the monthly. We have one this afternoon actually with Morriston, those monthly performance reviews, where the service groups who are now have an accountable officer letter asking them to maintain and deliver their budgets, now have that motivation, a higher motivation to work with us on embedding those savings schemes. And the exciting bit is they're coming up with ideas of their own, which is really strengthening the pipeline forward. So it is challenging because actually I understand the frustration with the performance and finance group about showing the planning rather than the delivering. And as a financial perspective, we are trying to demonstrate when that money will translate and set expectations of rather having a flat line, setting the right expectations of when we will start to see that come into fruition. And we're getting there. We're not there yet. We've still got a lot of work to do, but collectively we are focused as an exec team on a weekly basis and a service group on a monthly, if not more, basis. And I am confident that will enable us to have a more strategic plan going forward. So Abby, I don't know whether you want to elaborate more on some of those ideas.
Can I just check though, in answer to Steve's question? So the 3-year trajectory is based on the 181 million pipeline.
Yes.
Yeah.
And of that 181, we already have a further 9 million recurrent that within that pipeline. Yeah.
Thank you. So Abby, do you want to come in on that, and particularly as well, PFC have highlighted a number of capacity and capability issues, across different disciplines, from finance to program management, to operational capacity as well. So do you want to comment on that before I open it up, as I said?
Yes, thank you very much indeed. Welcome the conversation in Performance and Finance Committee. So we're doing a number of things. Firstly, we are continuing with some of the external support to one of the programmes of work in relation to the rollout of the ward staffing configuration that Liz is leading. So we've extended a very particular part of the external support that we had in relation to that. We're also looking to secure some particular expertise in relation to how we're managing continuing healthcare on the back of the programme of work and the opportunities that we identified through the work we've done with Deloitte. There will also be some national support as well, because it's a national programme running alongside how we ensure that we're able to provide the right kind of services for patients who may have complex or continuing healthcare needs. And we might need to be providing services in a very different way with our local authority partners. The other thing we have been discussing with Welsh Government is where else external support might help us. So Claire is meeting, is it every week with NHS P&I, the finance team there. So again, any scrutiny and any areas where together we identify some further external support would be helpful to us. We are aware, and we've alluded to in the conversation, and Claire's touched upon it. We do know that whilst this is the direction from government was a non-investment year, because we do not have the money to invest, there are priorities that we do have to commit to that have a consequence to them, a revenue consequence to them, and we are working hard to find ways of ensuring that within the total financial resource we have available to us, we are able to prioritise those areas. So you will be very aware of our need to right size the workforce in mental health, and we've prioritised the acute wards where we know that we don't have the right staffing levels, similar to the work, kind of using a similar sort of approach to the work that we're doing on Gower's ward. And we met last night in terms of what that uplift into the revenue needs to look like for that, but how in the totality of spend around mental health, where we've got complex cases or independent provider currently being required, that if we will look at how we might utilise that resource differently as we go forward. So and I'm aware that when we come to the board in July, we'll be bringing a business case that increases our Linacs South Wales cancer capacity in line with growing demand. And again, we will need to have a system where there will be some investor saves, and it will be part of reconfiguring how we deliver services, where we deliver services. There is also an ongoing conversation with Welsh Government colleagues, and I've got fortnightly meetings with one of the Welsh Government directors, who's now the kind of link in relation to escalation, and conversation about where there are other areas that we might benefit from some support. So we know that our pathology is out of balance, so that's one of our drivers, cellular pathology, for the current cancer performance. We're currently commissioning external capacity. Clearly we want to get to a place where we are sustainable, and looking at some work, commissioning some work through NHS, either P&I, and I know, Raj, you've had the conversation with the medical director there about some external view, in addition to the work we've done with Hywel Dda about how we might increase capacity in a most cost-effective way, optimising the resources we've got available. And looking at benchmarking in relation to mental health spend. Again, the benchmark information has not been easy to get out. Deloitte did a little bit of work on that, but it didn't really give us the assurance we needed to look at other areas about where we've got expenditure that we could deliver differently. Obviously, in relation to mental health, the transformation to a more strengthened community model crisis support to prevent an acute admission as part of our journey of transformation there. So we are picking up that issue. In relation to the performance point, Jean, that you raised with us, we do now have a rhythm of monthly performance review meetings with the service groups. We are continuing to develop and strengthen that approach so that we are focusing on the most important and pressing issues in those meetings. And as you'll see coming through our integrated performance report, we are strengthening what I describe as board to ward, but also obviously out into community as well and primary care. How at every level we're clear what the performance and governance arrangements are, what the reporting decision making within the scheme of delegation and standing orders and standing financial instructions looks like. And just to say that we are working, I can see Aidan's on the call, but we're working with the Good Governance Institute as we move towards care group implementation. What a really strong and disciplined governance arrangement, including performance management, looks like at every tier we will have in the organisation, which I think will really help with that grip and control. Happy to take any questions, Chair. Thank you.
Thank you, Abby, and that's comprehensive update as well. Nuria, would you like to come in?
Thank you, Abby, and thank you, Claire, for the update, and thank you to the Performance and Finance Committee. I think that there's a lot of reassurance that we can take from what you've just said, but we all know that regardless of grip and control and how brilliant or flawless a strategic plan can be and our performance framework, it will fail unless our team shares culture, morale and behaviours, and they're all aligned to support what we're trying to do. So can we just explain a bit more what we're doing in that front and how we are changing those behaviours and how we are aligning to our values and the morale and what we're doing about morale in our organisation so that we can all be part of the journey towards that ambition that we have to be an improving organisation.
Thank you, Nuria. And Tina Burda, I'm sure you'll want to come in on that.
Thank you, Chair. So first of all, we've got the staff engagement as one of our breakthrough objectives for this year. And we've got a set of actions against that, driven through the information that we've obtained through the staff survey. So the actions that we need to take to improve staff engagement. We've also got the performance and accountability framework agreed, and now need to embed that so people are really clear on their roles and responsibilities and the process that will be followed if they're out of kilter. I'm doing a wider piece of work, and we'll be bringing this through to a board development session in August about an intentional culture change programme to move us from the current culture to one of high performance. And had an initial conversation with the chair, but want to test my thinking through the exec team in July before bringing it to board. But to be a sort of a blended approach to it with 8 strands of that culture change, Nuria, so quite a comprehensive approach needed, and in my view an intentional culture change programme is required.
Thank you, Tina, and we look forward to more information on that. Well, it'll be an organisation-wide and from board to frontline in terms of that change programme. Pat, please come in.
Hi, thanks. It's just a quick reflection really on the 182 million, the 3-year requirement that we've got, which is, you know, is hugely challenging. I can completely understand why we've had to have this 100% focus almost on this year's 65 million, that nothing else could have been looked at to this point really. But moving forward, to drive out the next tranches of savings, the next 120 million pounds is going to take strategic, radical change, isn't it? Organisational change to drive those through. Many of those savings areas are going to need national discussions, regional discussions. They're going to be investor save options. There's going to be highly complex. And I was just really speaking, we need to be in the later part of this year starting to reflect on those, so we don't get into year 2 without kind of knowing which services, having some idea of resource requirements. What we need a kind of strategy, don't we, for how we're going to approach those as we go into year 2 and 3. And I was just wondering if we had any thinking around that at the moment.
And of course, part of our sort of strategic clinical services plan will underpin all that. So Abby, do you want to come in on that point before I bring in Anne-Louise on her points?
Yeah, Pat, that's a really helpful comment, and something we were discussing in the executive board yesterday around how we really pivot now to thinking about the plan for next year. We know we don't get the allocation till the week before Christmas. We won't get the planning guidance, but we can pretty much second guess what are going to be in both of those documents, subject to any change in the way that the new government might want to operate. So for us, it is about making sure the delivery unit is working with Claire's team. We are working very differently. The business partners, both in terms of finance and workforce, are feel to me much more engaged. They're coming to the Recovery and Sustainability Board as well, so that they are in those conversations rather than kind of getting them secondhand. So very grateful to Claire how she has changed the way that that's operating. And as the delivery unit gains strength in terms of training the people up who are all there already, bringing the new colleagues who are joining the phased development of that unit, and looking at where we might have skills gap, that will enable us to keep the grip on this year. Claire's touched upon, I think Pat, you mentioned that Claire's cracking on with getting a second deputy, so that she's got more time in that strategic space about how do we shift our resources over time, and also very conscious that the clinical services plan will need to dovetail in with the work we're doing on community by design, which is, how do you keep care close to home? How do you ensure that our community services are properly networked into our neighbourhood model, our cluster model, that we don't bring people into hospital unnecessarily? So, where does that interplay with health pathways that help guide referrals between primary care and secondary care, and that we've got a really transformed approach to outpatients, quick diagnosis, quick definitive decision about treatment, and we're able to deliver that really quickly. So all of those components will come through as part of that switch to a more strategic approach. And over time, we know we want to spend more of our resource in secondary prevention, where we know people have got risk factors that are modifiable, and we need to be working on that as part of our population health agenda. Of course, working with our communities themselves and our public service partners to enable communities to take responsibility for their own health and support people to do that. But when a risk factor is identified, making sure we're doing everything we can. So thinking about the 8 bundles associated with good diabetic care, for example, the work that we've probably referenced here before around cardiovascular risk factor, which can easily modifiable through medications that are cheap and freely available. So we know that over time we want to shift resource in that way. That's very difficult when you've got an underlying deficit that has to be the first thing that you serve in response. So freeing up some headroom for Claire to be able to think through how we do that over time, and can demonstrate that we are able to deliver more of our point of access into the community, and have the resource supporting that, and really utilising the opportunity of being an integrated health board to make sure that patients can be seen at the lowest level, close to home as possible, be the right member of the team or in the right multidisciplinary team, the right care, right place, first time, every time, by the right team. Thank you.
Thank you. And Pat, what we'll do in the autumn, we'll put a development session in specifically for the board to look at exactly what you said. How are we moving into a strategic focus? Thank you. So I've got Anne-Louise, then Tina to come back. Anne-Louise.
Thanks, Jan. My question is about delivery unit, and in particular pace and evidence. Given what Pat has said about the considerable gaps in the skills that are there, and I appreciate that Abby's just said that there will be more transfer of staff, but we're setting a huge amount of store by the success of the delivery unit to move on the various transformation and the delivery of savings, etc. And my question is, when will we see evidence, and how will that be presented to the board? How will we know that the store by which we set in the delivery unit will be evidenced?
So, Anne-Louise, before Abby comes back on that, we've asked Audit to oversee investment in the DU as 26-27 goes on, and the impact of that investment at the year end. So we've already commissioned Audit to actually do that piece of work, if you like, for the board. But Abby, do you want to talk a bit more about what more resources are going into DU this year?
Yeah, so and I wonder whether it might be useful for John to come and give an update.
Yeah.
He's when we commissioned his services, we were aware that he had a commitment to work in Melbourne, particularly around quality and safety, I think is what he's focusing on with his Australian colleagues. But he's back with us at the back end of this week, and perhaps we could provide through one of our sessions an update. Because as colleagues will be aware, this is about enabling and supporting. The delivery unit is, we've had various analogies about whether it's the oil or whether it's the engine, but fundamentally what we do know in organisations that are trying to achieve change, it's very difficult to give the frontline teams the headroom they need. So there will be a combination of approaches around how we embed continuous improvement and have a single methodology around that. You might use different tools out of the toolkit, depending on what improvement you're trying to make, but they are then connecting rods between an organisation that's is geared up for continuous improvement as an approach, and that we use our programme and projects to deliver the changes that we need, and that those cogs all fit together. So perhaps, Chair, if we could ask John to come back and give an update, either in a board development session or a board briefing session, and we can make sure we can reflect that in perhaps one of my chief exec reports, so it's also recorded in the public domain.
Thank you, Abby. So if you could pick it up in your chief exec's report of the July board, and we'll also ask John to come to one of the IM catch-ups. We've stood down the one this coming Monday because we've had the board today, but Hazel, perhaps you can liaise with John when he's back, and he could maybe come to the one after that. Thank you. Tina, do come back in.
Yeah, it's on that, and also about an update on the workforce plan as well, please, Chair. So to come back on that is, what we mustn't do is take away the accountability and responsibility of budget holders in this space and line managers. So the delivery unit, as Abby said, is there as an enabler. So there will have specific roles and responsibilities for that unit, but it's how the executive team portfolios, the job descriptions for the senior leaders, etc., have to be reviewed, and making sure that we have clear lines of responsibility and accountability, and we're holding the right people account for the right things. So that's what I'm working on as part of the Organise for Success programme, which you'll hear about later. And then the second bit is just to make sure the board's cited on it. We committed to reduce our workforce by 900 whole-time equivalents this year and for the next 2 years. We've one of the feedback from NHSP and I was we had to do some further triangulation of the workforce plan to our finances and to the phasing of the savings programme. Of the 65 million, 44.7 million assigned against pay budget. And when we've looked at this in detail, it looked odd because we used 50k as an average cost per whole-time equivalent. It looked odd for the medical and dental line, so that we were looking to reduce that by too many whole-time equivalents. So what we've had to do was adjust the workforce plan down to 800 whole-time equivalent, but it's still the same value, so the 44.7 million. And then that will be 550 whole-time equivalents against the substantive workforce and 250 against the variable pay. So that's a change from the earlier submission, and that's want to make sure that the board was cited.
Yeah, thank you, Tina. But it's important to note as well that the quantum of savings, 44.7 million, remains the same. Thank you. Diolch. So you have any other questions? Can I just flag one thing, not for detail now, but when we come back to looking at our strategic approach, from 27-28, we have to shift 0.5% of our spend left into primary care. And Steve sits on a national group that's looking at ways of baselining where we are now and how the whole of NHS Wales needs to apply that 0.5%. But Claire, picking up Pat's point about becoming more strategic, we will need that to build that in from 27, 28 onwards. But we'll come back to that when we have another session on moving in a more strategic direction. So if we have concluded our discussions on that, then if we can move to the recommendations, please. And we will obviously put on the record all the advice from PFC, but we will approve the submission to Welsh Government, and recognising what we're doing is approving another submission, answering in part the questions they've asked, but putting forward more detail ourselves, rather than approving the plan itself, which we know we can't do. So are we happy to approve that further submission into Welsh Government? Thank you. And then, you know, we do need to acknowledge, don't we, the significant progress that we've made through Q1, and that Pat and PFC members have acknowledged in terms of all the improvements made, delivery against all the actions we said we do, the frameworks we've introduced, and the evidence of grip and control. And we'll reflect everything that PFC has taken assurance from around that. So we clearly have major financial and performance risks remaining, but can we acknowledge now that the plan we have in place now does give us that credible and deliverable submission to Welsh Government, acknowledging, and I think we should say to Welsh Government, it's not just a question of, you know, Welsh Government disappointment. We are disappointed as well as a board. And, you know, we know the executives are obsessing every day on bringing our deficit down. And that's what we're about as a board. So we want them to understand we have shared purpose in this. Is that okay? And then we will continue with our focus on delivery, oversight and assurance, clearly to implement the plan that we are working to this year, and mitigation of current and any future risks in year. And given, as Abby told us at the start, we've got to set this in the strategic context, the 3-year trajectory informed by our clinical services plan that will report later this year. Are we prepared to approve the trajectory that gets us back to the total control target and then subsequently to balance in 28-29? We are? Okay, thank you very much. And Claire, Abby, thanks to the executive, the service groups, for everyone who's involved in actually strengthening this work and moving us forward, really, towards financial and service sustainability. Diolch. So we hope that we have Aidan Rave with us now from GGI. Is that right?
Yeah, I'm here, Chair.
Oh, Aidan, good morning, and thank you for joining us. We thought this was opportune, as we've taken a number of pieces of work today to conclude the 25-26 financial year, as you undertook our stakeholder feedback work in 25-26. It was timely to hear from you in terms of the feedback, and we know you have some recommendations, and then we will just be discussing how we'll put an action plan together. And we do have Karen Stapleton from Planning and Partnerships with us in Marie's absence. So Aidan, at that point, can I hand over to you? You can take it that all members will have read the report. So we'll be interested in you know, the highlights, the learning and the recommendations, please.
Thanks, Chair, and Borodar, everyone. Great to see you all. Great to be virtually back in Swansea Bay, even though we're not there in person. Although a trip to Cardiff on Monday with a train with no air conditioning has put me off for this week, frankly. So I'm not that disappointed not to be back on a train. Yeah, as Jan said, we've produced a report which I'm not going to necessarily kind of go through page by page, but what I have done is tried to extract some of the headlines from it in a slide deck, which I was going to just kind of run through with you, pick out some of the highlights, and then hopefully we can have a bit of a conversation about the implications. So I won't do death by PowerPoint, don't worry. I'll do a quick canter through some of the headline messages. So I'm going to just try and share my screen and hopefully this will work. Has that translated? Is that there? Can you see it?
Yeah.
Yeah, great.
Yeah.
Okay, so just to kind of remind ourselves where we started. So the purpose of the review is to give you a kind of an independent, objective, dispassionate assessment of what some of your partners think about you. The methodology, as you will well know, is us talking to them with the assurance of confidentiality and not attributing who said what. That's important, obviously, because it enables people to speak without fear or favour, and gives them the safe space, if you like, to speak with candour and with openness. And we find that's particularly helpful when we do these stakeholder reviews, because you kind of want to hear what the unvarnished truth is. You know, there is I think a peculiarly British habit sometimes that we don't always speak the same way when we're face to face with somebody, that when we're perhaps what our innermost thoughts are. And it's actually useful for organizations to hear some of that and to hear what that actually means. So it's not an internal performance review, it is purely an objective snapshot of what your stakeholders are thinking about you, and it gives you the opportunity to affirm maybe some of the suspicions that you had about where that relationship was, to challenge some of the others, to give you opportunities ultimately to strengthen relationships and to improve inform your future improvement. It's, I think, in terms of obviously having worked with you as a board now for a period of time, we've talked a lot about the challenge of high maturity and kind of what the next challenges are. Mature boards tend to be instinctively outward looking. They kind of know the world that they're operating in. They have good situational awareness of what's going on around them. And, you know, in terms of the journey that you've been on over the last few months with the money that you've just been talking about now, with the relationship with Welsh Government, with the relationship with some of the assistant partners, I think that's now coming into focus in terms of just how important that is in your future. And I think you're making a huge amount of progress. So let's sort of get to the nub of the issue. What's the headline message? Well, I think the key kind of message that came out of the report was that there is a huge amount of goodwill in terms of the intent that you've shown to engage with stakeholders. And perhaps unsurprisingly, there's a bit of inconsistency in terms of how that lands. And there's some specifics around that we can drill into a little bit further. The good thing is, though, that commitment is clear. I think there's a good understanding from your partners that you are serious about engaging with them. You're not only serious about it, you're making tangible and demonstrable efforts to do that and to turn it into a reality. And you have a very kind of open and accessible tone at the top of the organization, which is a huge strength, I think, for the organization and a real platform to build with. The experience then in terms of how to use that phrase, how the rubber hits the road, is a little more inconsistent, and that's perhaps somewhere where we can think about how stakeholder engagement works across the whole organization as opposed to just within the senior team. So I think the key kind of takeaway from this exercise is that the next challenge is turning some of that intent and that goodwill into consistent delivery. And by the way, just to put this into some context, I recently did a session like this with a group in an NHS trust in England, in the south of England. And the message actually was quite different. The message was that the stakeholders didn't feel like the senior team were taking stakeholder management as seriously as they should. Not out of any malign reasons, purely because they were so distracted, so you know the story, so much up to their eyes in kind of horizon one challenges, money, performance, waiting list, etc., etc., etc. But the stakeholders didn't feel like the intent was there. This is very different. The intent is very much there. I think we've just now got to translate that into hard outcomes. So what's working well? Okay, so I've mentioned this, the visibility, openness and accessibility of leadership. That's very widely recognised and came across very, very clearly. There are good and strong and strengthening relationships in key system areas. And I think that that last word is very important, because you are continuing to put effort into building and growing those relationships. You've been very clear about where you are and some of the challenges that you face, and that candor has been appreciated by your partners. And you have demonstrated a pragmatism in terms of engaging with partners at their level, at their kind of when, you know, in terms of where they are, which is, you know, within a system obviously a diverse picture. And in order to be an effective partner, it's as much about what you bring to the table as what you take away from it. And, you know, I think one of the main challenges with this kind of concept of system, which both in England and Wales, I think the NHS is still wrestling with, frankly, is the extent to which that's oiled by the goodwill of the partners, the investment that the partners are prepared to make in it, not just what they see that they can take away from it. So a good and respectful set of mature relationships with partners, a great platform to build on. Where is that less effective? Well, I guess the key, and this was really in the headline message, is that there is a palpable gap at times between what you say at senior level and what people's experience of the service ultimately is at operational level. Now, that's not unusual, but it is a challenge to meet. Now, you know, I think for most large scale organizations, if we were to do a kind of, you know, reverse the polarity exercise and did a stakeholder review on behalf of Swansea Council, just to pick one at random, and asked you the question about what your experience would be, I suspect some of it would manifest itself as a frustration of the difference between intent and reality. That's not unusual for a large and complex organization, but we're not into a board here that's looking to just be okay. We're looking to a board that's looking to be mature and high performing. And therefore, this gives us, I think, a really clear picture of where improvement can continue to be made. So and I'll come to this as almost my denouement at the end, my final kind of thought to leave you with. Your ownership of the importance of stakeholder management will radiate across the organization. It will influence the way that the wider organization operate. Your scrutiny of that impact that's being felt at operational level, your oversight of it, your holding to account of the organization will have an effect on them. And I think that's clearly an area that your stakeholders are telling you they want to see some improvement in. So I think that's a nice, neat, you know, opportunity to continue to improve. There are some processes that are seen to be slow pace. I suspect that's to do with distraction and to do with the number of things that you've got. But again, in terms of the experience of stakeholders, that can be frustrating if they want to move with agility and at pace, and there are areas where they feel that you can't match that. And again, that consistency in terms of message from the board, I think, is going to be really important in ensuring that happens effectively at operational level. A fairly repetitive refrain from some of your stakeholders was that the engagement is too late sometimes to influence decisions that feel like they've already been made. Again, there's a kind of an inevitability about, in a very fast moving environment, how this happens and why this happens. But it is frustrating for stakeholders when they feel like they're investing time in you to engage with you on a particular matter, a particular policy, but that there are, there's a kind of underlying inference that the decision's really already been taken. So I think curating that message, building that trust continually, obviously, is going to be really important. You've had some executive turnover over the last sort of 12, 18 months. We know about that. It's just a matter of fact. It's a feature of where the organization's at, but of course that doesn't help in terms of kind of consistency and continuity and building that trust that's really important for really high mature stakeholder working. So again, I think, you know, there's clear plans to move beyond that period, but just be aware at any time that change creates uncertainty, and therefore sometimes it's important for maybe the wider board to just kind of wrap around some of that that churn and that change that inevitably happens in organizations, and exude that kind of message of continuity, because that underpins the trust that you're trying to achieve. And occasionally a limited consistency in terms of working across regional level, and this was specified more in operational terms than it was in strategic leader terms, but almost revert back to point one. You need to own this and therefore kind of shape the way that the organization responds to it. And as you do, I think that visibility issue will begin to evaporate. So what's the impact on the system? Well, there are some frustrations in terms of missed opportunities, and I think, you know, the bottom line here, colleagues, is about, again, this is not just about ticking boxes and saying, okay, well, we're doing everything we need to do. This is about stretching into a high productive, high maturity, high trust relationship with your partners, that gives you the ability to not just comply with what your obligations are, but to burst beyond them, and to create that kind of real sense of innovation, of oversight, of system working, where the NHS is not simply the kind of repository into which the ills of communities are poured with the expectation that they'll be put right by you. But the NHS is functioning as a part of a system that's recognising that 80% of the health outcomes that people experience are actually nothing to do with their physiology, but to do with their surroundings, their environment, their wealth, etc. And this is an area where your influence is, I would say, not just necessary, but critical. Absolutely mission critical to creating a different set of health outcomes. So I think the overall kind of impact on the system is one where we need to kind of lift our sight a little. We need to think more into that kind of space of Horizon 2 and 3, and we need to have a whole organisational response to how the stakeholder environment can be turned to the advantage of outcomes across that system. So what do your partners want? Well, very practically, they'd like to be involved earlier in some of your decision making. Not always easy to do, but not impossible, and therefore need to think about the means by which that you can move kind of upstream and engage them earlier, probably through some element of formal, mechanical, you know, go back to the mechanics and the dynamics, some process areas where you can kind of improve the information flow through in terms of your earlier thinking, and some areas which are much more to do with dynamics, the kind of strength of the relationships. And you know, I would say, as we kind of digest the implications of this report, one of the consequences for the board to consider is how can the whole board play a role in this, rather than it just be the executive, rather than it just be Abby, rather than it just be Jan. How is there a role for the whole board, without kind of getting in each other's way and stepping on each other's toes, to meaningfully engage earlier in building kind of those relationships and sustaining them, because that really is starting to shift into high maturity. Obviously, involving them earlier is one thing, but then following through on what you say you want to do is absolutely critical. And that's, you know, that's like any relationship, isn't it? It's about us being as good as your word, about if you say you're going to do something, doing it, and having that reputation within the system for being an organisation that delivers and follows through. It's not to say that that's a massive problem. I think it's to say that that's where you can improve further, and there's a big opportunity to do that. See governance, and we would always say this, wouldn't we, as kind of proportionate and enabling. So that's again back to the mechanics, ensuring that that kind of system working is designed correctly. And again, I think there are some kind of tweaks and some nuances that the partners are looking for in terms of improving some of that. And then, you know, finally, and I think this absolutely comes back to the board, your visibility, your commitment, your articulation of the importance of working at system level, because you are a system leader. You are you know, utterly critical to the outcome of well-being in Swansea Bay. not just in health, but in broader well-being as well. And therefore, your leadership is absolutely manifest and critical to that. So I'm not going to go through these in great detail because these are a reiteration of some of the messages that are in the report. But, you know, briefly build on those strong foundations and recognise what the areas where inconsistency exists. And I suspect you'll know where some of those are already. So again, it's about grabbing it and holding it. Identify what some of those levers are, what sits underneath that inconsistency. Again, sort of, you know, the opportunity here is not to rush to an immediate fix to all of this, but to build this into your already ongoing board development environment, the work that you're doing on improving already. Turn some of this into the tangibles that can continue to improve that kind of sense of leadership of the system. Turn then that into deliverables in terms of, so what does this mean? So ensure that you know, your approach to partnership is person dependent, and you level out some of that unevenness that exists. And create that kind of predictability within the system. And again, I think that requires a whole board response to it. So, you know, the overall message is on ownership, it's on consistency, it's on agility and that ability to move at the pace that the system needs. And, you know, to lead that debate. You are an ambitious board. You want to get ahead of the curve here in this agenda. So this is not about waiting for somebody else to tell you that this is what they want to do. This is about you leading that debate, because that's already what you want to do. So what have we recommended? And you see in the report, there's some fairly detailed recommendations that run through. We want to kind of emphasize that point about clarifying expectations, and being clear about the leadership role that you've got in the organization. Focus on some of those ways of working so that we deal with some of the issues that underlie the inconsistency that's caused some of the frustration. Engage and communicate again, and really think about what that means in a whole board environment, not just Richard doing it, or, you know, somebody else who's, you know, Abby or Jan or the usual kind of suspects. Of course they're going to lead this, of course they're going to be at the forefront of it, but there's a role for the whole board here, and we need to understand exactly what that is. Lead that system, because I think it's looking for leadership. You're a respected and key part of it. There's a space to move into further without being arrogant, without dominating, without trying to, you know, to kind of be the kind of the most important person in the room. Be a leader within the room. Be an enabler of some of your colleagues who perhaps don't have that voice in the voluntary and community sector, and certainly within local government, but to articulate the clarity of vision that I know you've got, and use that experience to continue to learn and improve. I mentioned earlier that I did a session like this with an NHS trust in England. The response to the board was really interesting, because it was defensive, it was quite crotchety, it was in some instances almost bordering on rude, you know, don't shoot the messenger kind of thing. And I thought that was interesting, because that gave a bit of an insight into where the board was at that time, and some of the frailties that their stakeholders were actually trying to highlight, they were exhibiting in their response to what their stakeholders have said. I think this is a sign of maturity, that you've had the confidence to go out at this time with a stakeholder review, to take on board some of the findings that you've got, but really importantly now to take these recommendations forward and build them as part of that ongoing maturity journey that the board is in. So what are our final conclusions then? So you've got strong foundations to build on. You've got to address on that inconsistency, certainly at operational level, and I'm sure that's something that you're already starting to work on. But really, I think the board response to the criticality of system performance is really important. This is the only thing that ultimately changes the needle. You can pump as much, but you know this already, you can pump as much money as you want into acute care, into response times. You will never feed enough money into the NHS to satisfy its hunger. You've got to move upstream and shift to some of the preventative areas, and that is about your influence within the system, not about the effectiveness of your response times in the emergency room. So you know that you want to do that, you want to lead that, and I guess this is the opportunity to really now turbocharge that as part of your overall development as a board. I think I've said enough there, Jan. I'll leave it there and open it up to a discussion. I'll take these slides down.
Thank you. They've given us a lot of food for thought there, Aidan. And as I said earlier, we're very pleased that we've got the building blocks of effective partnership working in place that we can now develop with all our diverse partners. So I'll just open it up for any comments, queries, or questions, and then Abby, I'm sure you'll sort of set out for us how we will be putting an action plan together. So are there any points for Aidan? Richard Brodar.
Jan. Hi Aidan, thanks for such an insightful and helpful document. It really is strong, and it's going to add a lot of value, I think. And I think the timing is really good as well. We've already heard in this meeting about transforming for the future and the way in which we need to develop our long-term clinical services plan for the future. And intrinsic to that, I think, is the way that we work with partners and stakeholders, including local authorities, a voluntary sector, and other partner organisations as well. So I think it'd be really helpful just to pick up some of the elements within the report that you've produced and work out how that might manifest itself in terms of, tangible actions that we take as part of the transforming for the future process. So I know that Jan and Abby are already planning on engaging directly with the local authorities, including the full councils, which I think is really, really important as we go through this process. But I think there's also lots of other nuggets in there that we can use now to make sure that when we do come out with transforming for the future, the long-term plan, that it really does do so, that we do so having got that sort of strength of input from a wide range of partners and stakeholders, and they feel that they've been part of it too.
Thanks, Richard.
So I've got Andrew next, then Raj. I can't see a number 4, but then there is number 5. There must be a number 4 somewhere. Andrew.
Yeah, no, thank you for that. The report and the explanation of it. I think what's been useful today really is the triangulation it brings, I think, to some of the discussion we had earlier on, particularly around audit. And it seems to me it's that connection through the organisation. There's a willingness at the top, but willingness is necessary but not sufficient. It needs to be driven down and through the way that we work together. So I felt reasonably pleased with the report, in that the stakeholders are getting that view that at least we are willing and we want to make this work. So I felt pleased with it, and I just wanted a reflection back from you. Am I right to be pleased, or do you think we're being overly keen without seeing the good news rather than the bad news? But other than that, I think it's really helpful triangulation of what we've already talked about.
Thanks, Andrew. I just picked that up. No, you absolutely should be pleased with this, because I think the platform of goodwill is never to be underestimated. And listen, I've done quite a few of these over the years, and they're not. I cited one that I did recently. They're not always as positive as maybe the organisation is hoping for. I think there's a very kind of underlying positivity in this, a real platform to build on. So I absolutely think that this is a good starting point for taking your ambitions forward.
Thank you. So we've got a lot of interest in this. We've got Raj, Pat Dunmore, Nuria and Martin that I can see, and then I'll ask Abby to bring it to a conclusion. So Raj.
Thank you, Aidan. I happened to read this last night, and it did set my head racing a few things, but I think I found it extremely constructive document. I just actually had 3 things just to ask you. First and foremost, the question was with regards to the report clearly states about a gap between the senior intent and operational activity. You did touch upon it, and my question was the fact that, was it more at a corporate level or at an operational level? That was my first question. And where was it? And you did touch upon with regards to the execs changing and other stuff. And so, just making sure that how we could actually act on the report if you're actually moving forward. The second question I had was with regards to the report again notes that governance is complex, decision making is slow. It does make sure that. And my question again is the fact that is it because of the partnership or is it because of the constraints sometimes NHS do actually have? Sometimes it's like financial, it could be actually be the regulatory one. And my last one, which did worry me, was actually insufficient. They was actually saying that the risk is displaced rather than managed collectively. That's a phrase I took out of your report. And my concern is the fact that was there a clinical consequence because of that? So those were my three. Thank you.
Yeah. Okay. I mean, I'll take them in reverse order. Now, the risk I think is more to the productiveness of the partnership working rather than anything else. I think that was the lens really that we were focused on. So certainly not into the clinical area, although, you know, this is where organizational culture comes into play, isn't it? Because if that's perceived as being manifesting one side of the organization, then the kind of danger is if it's not challenged, it becomes manifest in other parts too. So I think keep it under review, but it was very much within that kind of partnership environment. I think the governance constraints are an inevitability of a large organization, and this is not about kind of waving magic wands and suddenly becoming, you know, a tech business that's light on its feet and is able to change every other day. This is about your awareness of the way that that's perceived externally, in the same way, frankly, that, you know, again, to use the example, if we asked you to describe your relationship with Swansea Council, for example, I bet you'd say some of it drives you mad because it moves at a glacial pace. Big organizations do that at times. It can be frustrating. But your awareness of it helps to just address some of that challenge. So I think, again, it's more about hopefully helpful messages to the board to just understand what that feels like from the outside looking in. And in terms of whether it's a kind of mismatch at corporate or operational level, again, I think the lens is very much at the corporate end. It's more about initiatives and direction of travel that you're articulating as a board flowing through into tangible outcomes that happen at kind of you know, community level within the system. So you can imagine that there'll be 1,000,001 meetings happening kind of every day at micro level across the community, of which your people will be attending, participating, contributing, being part of. I think, and this is not, you know, this is not to try and constrain them and say that they all need to be kind of trotting out exactly the same message. That's unrealistic. But it's about the frame and the kind of culture that they operate in and the way that you kind of set that. And if that's, as I believe it is from your perspective, one where you want to be quite permissive in terms of building relationships, developing links, in enabling outcomes, then it's just ensuring that that's the experience that other stakeholders are getting at operational level from the organization. It's a very doable thing. It's not easy in a large organization, but it takes, you know, the leadership from the top and then the consistency of just checking that that's happening through the organization, much in the way that Richard cited.
Thank you. So now I've got the numbers in front of me now. So Pat Dunmore is next then. Pat.
Hi, thanks. Yeah, I thought this was a really good report, a really fair reflection of the relationship with partners and stakeholders, particularly from the third sector point of view. I think we know the intent is so obvious in wanting to engage and wanting to work properly, but occasionally on a practical level it doesn't work. But I mean, one of the things I found over the last 15 months or so trying to recruit new members to the SRG is that initial surprise when I describe how the SRG works, and it's like, really, we can go along and talk about things, and that's beginning to be accepted now, and it's sort of forming that trust. But that's sort of with grassroots organisations. So, yeah, no, I thought it was a very, very good report.
Thank you. And thank you, Pat. And as one of our key stakeholders, the stakeholder reference group, we will be happy to come and discuss with you our action plan, you know, when we meet with you. So Karen, please come in.
The Chair.
Karen?
Chair, I think Nuria is before me.
No. Oh, all right. Right. So let's move to number 1 now. Right, Nuria, do come in then.
Actually, I think it probably links in with some of the work that Karen has been doing. What I wanted to say, but in terms of your presentation, Aidan, similarly to Pat, you know, I am the third sector representative in the board, and I think a lot of what you just raised actually triangulates really well with some of the experiences that they've shared with me in the past. I think it's that system level transformation that you've described, where we can really work on that productivity, where I think that we really need to strive as a health board, and what that looks like is still under development. But I think we, you know, that positive note that Andrew took, I take it too, because when I listen to our stakeholders, what they say, we went to a cluster event not that long ago with the third sector and some of our GP practices. And what they were describing was, in terms of the relationships that we have with our stakeholders, we're in a really healthy place where they really do want to engage. And there's a bit about, you know, how do we engage those seldomly heard voices, which fits into that transformational piece. And I think, again, that's something for us to think about, and to think about in relation to our population health strategy and the gains that we're making there. The other part for me is around governance. Now, we've been working very, very closely with Karen and her team in kind of understanding what the stakeholder map was like, because there's a lot of stakeholders involved. And I think that we now have that understanding, but it's that kind of impact on what does that look like. And it would be really helpful to understand from the executive how they're thinking of those stages. And I know we've had those discussions, Karen, in the audit committee, but I think it would just be really helpful just to give a flavour of some of that thinking in that space, because what we've gained is just clearer clarity of who our key stakeholders are, and also the influence that we have in relation to some of the key outcomes and the purpose of what we're trying to do in that transformational space. Those were some of the observations that I had, and I think I probably have more questions than answers at this stage, but it's really helpful in terms of sharing the reflection of where they think we are as an organisation.
Thank you, Nuria. So Karen, then Martin, then I'll ask Abby to sum up. Karen.
Thanks, Chair. Just to echo that we really welcome this report and absolutely recognise the areas for strengthening as well. So I think it's really timely. At execs yesterday, I was presenting our partnership update. We've got much more focus now at board and at exec level on what we're doing in our partnership space. And part of the discussion we had yesterday was about, if we are going to shift to that more transformational space, as we heard earlier on in this board, and really transfer, we need system leadership. And I think that's an area that we really need to work on, colleagues with Tina, as we develop our leadership in our boards, our care boards going forward in the health board, because having that ownership, understanding the system leadership is different. We need different skills and capabilities, owning that system, not just the operational bit you're a part of, and then empowering from the board that people can lean into that space. I think it's going to be really important. And we talked yesterday about the way we're seeing some of the partnership space go now. It's about place-based working with communities, working on inequalities, working with the communities who are harder to access our services. And I think that's where we'll start to see some of the impact area, if we are really focusing our activities in the partnership space. And our partners want us to do that. You know, Swansea Public Service Board, they're focusing on particular areas of Swansea to make improvement, police, fire, environment, health. I think that's where we can start to see that impact. So yeah, really welcome it. And we've also got in place a collaborative framework, which we've taken through board before, which is about our approach to partnership aid. And I think we can build on that and take on board a lot of what you're saying here. So thank you.
Thank you, Karen. And Martin, final word to you.
Yeah. Thank you very much, John. Aidan, thank you for the report. And for me, it's an encouraging point and a positive one, really, as a comment. And I think it stems from the leadership within the organisation, because I can see that stakeholder groups are many within the organisation, really, and partnership is effective. For me, the partnership primarily would be the staff partnership within the organisation and how it all functions as well. But I think the strength of that, really, and the engagement is coming from the top down. can see Abby's sort of involvement in the leadership and engaging with staff really is coming to fruition, and I can see that trajectory of positivity within the organisation as well. So it's, for me, the picture is a positive one. It's all going good, as said, despite some of the upsets that we had at the end of last year and the beginning of this year. But I can see we've come a long way in 6-7 months now, going into the summertime, really, where that partnership and the staff groups within the organisation are really seeing the benefits of the leadership within the organisation now. And I think the presence and the visibility, I think, is important as well. And from a health board perspective, and how we as a board engage really with staff across the board in their services that they formulate and run, I think is important as well. So it's a positive one for me. Thank you.
Thank you, Martin. Abby, do you want to sort of sum up where we go from here, please?
Yeah, thank you, Aidan. It's a really helpful report. It's really helpful to have the mirror fed back to us in terms of where we are positioned as an organisation. And I do take the positives out of the report and welcome the recommendations about how we can further strengthen it. And Martin, thank you for your comments about our engagement with staff side. Just linking back to other conversations, we know that how we reach the 14,500 people we've got in our organisation, and how we improve the communication and improve the visibility in the way that you've described, I think is really important. We had a discussion at the exec board yesterday about how we keep the focus on things like our reward and recognition approach across the organisation, because we recognise that's a really important partnership with our staff. In terms of external partners, Chair, we will take this into our next exec way day. Aidan is facilitating our away days to think about how we can reflect this in the work of the executive team and in the work of the board. And we might bring it back to a further board development session. So hearing the comment that you made, Aidan, about sort of distributing this and making sure that we're kind of all leaning in the right direction. And I think just in terms of some of the key partners, Richard's right. We had a very good conversation with one of our local authorities this week and talked about how we can use the opportunity of coming to talk at early point in our discussion around the clinical services plan with our council colleagues. And we've got an exec to exec coming up with Hywel Dda to help strengthen the relationship we've got with Hywel Dda and really push forward how we accelerate that partnership in terms of it now being up and running for a couple of years, kind of taking stock on the back of the audit work that's been undertaken. And I think the other two sectors, Pat, really encouraging what you were saying about the stakeholder reference group. We do a lot of work with the third sector. I think we can build on that and do more. And then finally with our university partners, predominantly with Swansea, Charlotte, but we also have good relationships with Trinity St David's and their provision within the Swansea Bay footprint too. We are due to have another exec to exec with Swansea University. I don't know that the date's gone in the diary, but we met a year ago. We met in July last year, and we found those conversations really important. And I guess the thing for me is that it can take a long time to build trust and confidence with partners, and that can be lost in a moment. It can be lost in the way that we interact in a meeting, the way we communicate, and it's one of those that we need to give attention to all of the time. And the work that Richard's been doing on our public affairs, public relationship strategy that came to the board previously about how do we know how the relationship with any of our key partners is feeling, and where do we might need to give some specific attention because that we need to, maybe we've been focused on something different, or we need to engage with our partner for a particular purpose, and just keeping oversight of that. And Richard's work is really important in helping us do that as our lead on the communications and engagement. So we've got a sense of actually we need to spend some time with this partner for this particular reason, and we need to do that purposefully. I think the other thing I wanted to just say is I wanted to make the connection back to our diversity and inclusion agenda. We do know through our strategic equality plan that we've got more work to do in terms of the diversity of our partners and communities, and our partners are often a very useful connector to AR communities, but different groups as well. So if you think about the third partner groups that represent particular cohorts or patient communities or citizens, and similarly, Alan, the local authorities recognising that some of your councillors have really good connections within the community, and we've recently had some contact with one of your councillors from the Asian community in Neathport Talbot, and thinking about how we can strengthen those links, perhaps with a focus around mental health and enabling people from global majority populations to have appropriate and equitable access to some of our services. And I think we need to come back to that lens on this as well. It wasn't the focus of the work, Aidan, but we didn't ask you to give a focus on that. But I think there's a sort of a context to our partnership agenda where that lens is really important to us as well. Thank you, Chair.
Yeah, thank you. Abby and Aidan, helpfully, you will be continuing with the work when you're facilitating the executive team times out. And of course, it is a fundamental responsibility of the board to build and sustain strategic partnerships. So we will be looking at how the board itself does that. And for example, in July, the Chair and Chief Exec of the Joint Commissioning Committee will be meeting us at our board. So that is one very important partnership for us to build on, really. But we'll definitely come back to how the board itself engages. So Aidan, diolch yn fawr iawn. Diolch am eich amser. Thank you very much for your time. So final item before we close. Hugo. You know, we talked earlier, we've referenced the extreme weather, and of course it's, you know, it's really testing for patients and staff. And we know there have been multi-agency groups set up on this and advice from Public Health Wales. Would you like to talk the board through what we're actually doing in Swansea Bay, please?
Yes, no, sure. Very happy to give an update on the situation. So I think the overall response by the organisation so far has been very, very effective in relation to the pressures they've been under. There's just been a decision in the last hour to go into a BCI just because of the heat wave. But just to give you the background, we have had gold and silver meetings happening since Tuesday to allow oversight and planning, and they'll continue till the heat wave is over. Silver has met 3 times a day and gold once a day. The particular at-risk groups are the very young, the under 5-year-olds, and then the elderly. And there are also some other vulnerable groups that we are making steps to contact as well. So just in terms of the main focus, the first main focus is external communication, which we coordinate in conjunction with Public Health Wales. And the DICE team are very helpful, have been very helpful in that regard, making the public aware of the risk of dehydration and heat stroke and the steps to take to avoid that, and also working closely with local government colleagues on messages, particularly for care homes and children's nurseries. The internal communication's also been stepped up, and I'm grateful for support on that, particularly just ensuring that we've got clear standard messages across the organisation, for example, in relation to questions that arose around uniform. One issue that has been a source of pressure has been the closure of a lot of local schools, which impacts on childcare arrangements for some staff, and but I think that has been well managed. WAST have been under particular pressure, and we're seeking to support them in that regard. And then I think hopefully the temperatures should start to drop tomorrow. We will continue the gold and silver arrangements until we're certain that we are in a position to drop that approach. So finally, I'd just like to thank the emergency planning team for their support around this, and also all our staff who I think have responded really amazingly to step up to this extra challenge. Thank you.
Thank you, Hugo. And Abby, would you like to come in there?
Yeah, thank you. And just echo my thanks. What has been really good to see is that our arrangements have kicked into gear as we planned for. and we've mobilised in the way that our extreme weather protocol and policy would require us to. I was just going to ask Craig, we do know that some of our theatres are running hot, literally, and that may be impacting on some of our planned care activity. Craig, do you want to just give a scale of that? I'm sorry to put you on the spot. I know it's being reviewed out the course of the day, but last night's conversation, we did think that some of our activity might need to be curtailed today, which I know will be hugely disappointing to any patient who was expecting to have surgery, and we apologise for that. But obviously needing to balance that with ensuring that we've got environments where we can safely undertake surgery.
Right.
Yes, thanks, Abby. Thanks, Chair. Yeah, so as a consequence of the extreme weather, we've taken the decision to take down the majority of activity in Single Link Hospital, particularly around the day surgery unit. So I've cancelled around 36 ophthalmology patients today as a consequence of that. It's had an impact as well on other services such as ENT. We were reviewing the situation this morning in Morriston in terms of cardiac, whether that went ahead or not. I haven't had the outcome of that as of yet. But it was just based on risk. I've asked for an assessment of these cancellations, whether that will impact on our end of June position. So I'm just waiting for that information to come through. I mean, in terms of ophthalmology, fortunately, we're in a relatively good position with ophthalmology in terms of our waiting times. Because we're around about 70 weeks rather than the 104 weeks. So I don't anticipate that is going to be an issue, but we may see potentially see a couple of breaches in some of the other specialties, but I'm just waiting for the detail.
And Chair, just on that, just to say that because I had my regular fortnightly meeting with my link director in Welsh Government, I did let him know we are not alone in that, in terms of needing to take some decisions, and they understand that. Clearly, it would be disappointing if our 104 position slipped, because we worked very hard. But as Craig said, it's important that we are able to proceed safely and take decisions where we need to curtail activity. So really grateful to the operation teams who are working really hard at the moment.
Thank you. And the board would want to convey our appreciation to everyone, really, all our staff who are working in these very difficult circumstances, in extreme heat. What is it? The second red heat, because the second red flag for extreme heat, I think. So we are appreciative of everything our staff are doing. So I'll bring the meeting to a close by just finally saying to Chris, we said goodbye to you face to face. And now we're saying goodbye to you online. So you had a lovely retirement presentation earlier in the week. I hope you just went away with a great sense of pride of all the lovely things people said about you and your long, illustrious career that people set out. We wish you well, Chris, and you know, please stay in touch. And as you know, they were trying to get you to agree to an on-call rota responsibility, weren't they? But you were resisting that. You never know, you might come back to it. So okay,
thank you very much, Jan. It's been weeks of long goodbyes, so I've got only 4 working days left now, and this is my last formal meeting, so this is the last chance in that. So thank you all very much for everything. I've had a great career and made great friends and great colleagues. Thank you very much.
Great. And they'll still be here, you know. They're still here for you to come back and talk to and see us. Okay, I'll close the meeting at that point. Diolch yn fawr iawn I chi gyd am eich cyfraniadau. Thank you all very much for your contributions. We've covered a lot of really important ground today. Diolch. So we are reconvening at 1:15 for a separate meeting. So diolch am now and hwyl am now. Bye for now and thank you for now.